13 foods that could lower your risk of cancer. What you eat can drastically affect many aspects of your health, including your risk of developing chronic diseases like heart disease, diabetes, and cancer. The development of cancer in particular has been shown to be heavily influenced by your diet. Many foods contain beneficial compounds that could help decrease the growth of cancer. There are also several studies showing that a higher intake of certain foods could be associated with a lower risk of the disease. If you're interested in knowing what kind of food can lower your risk of cancer, then please keep watching. Number 1. Broccoli. Broccoli contains sulforaphane, a plant compound found in cruciferous vegetables that may have potent anti-cancer properties. One test tube study showed that sulforaphane reduced the size and number of breast cancer cells by up to 75%. Similarly, an animal study found that treating mice with sulforaphane helped kill off prostate cancer cells and reduce tumor volume by more than 50%. Some studies have also found that a higher intake of cruciferous vegetables like broccoli may be linked to a lower risk of colorectal cancer. One analysis of 35 studies showed that eating more cruciferous vegetables was associated with a lower risk of colorectal and colon cancer. Including broccoli with a few meals per week may come with some cancer-fighting benefits. However, keep in mind that the available research hasn't looked directly at how broccoli may affect cancer in humans. Instead, it has been limited to test tube, animal, and observational studies that either investigated the effects of cruciferous vegetables or the effects of a specific compound in broccoli. Thus, more studies are needed. Broccoli contains sulforaphane, a compound that has been shown to cause tumor cell death and reduce tumor size in test tube and animal studies. A higher intake of cruciferous vegetables may also be associated with a lower risk of colorectal cancer. Number 2. Carrots. Several studies have found that eating more carrots is linked to a decreased risk of certain types of cancer. For example, an analysis looked at the results of 5 studies and concluded that eating carrots may reduce the risk of stomach cancer by up to 26%. Another study found that a higher intake of carrots was associated with 18% lower odds of developing prostate cancer. One study analyzed the diets of 1,266 participants with and without lung cancer. It found that current smokers who did not eat carrots were 3 times as likely to develop lung cancer, compared to those who ate carrots more than once per week. Try incorporating carrots into your diet as a healthy snack or delicious side dish just a few times per week to increase your intake and potentially reduce your risk of cancer. Still remember that these studies show an association between carrot consumption and cancer, but don't account for other factors that may play a role. Number 3. Beans. Beans are high in fiber, which some studies have found may help protect against colorectal cancer. One study followed 1,905 people with a history of colorectal tumors and found that those who consumed more cooked dried beans tended to have a decreased risk of tumor recurrence. An animal study also found that feeding rats black beans or navy beans and then inducing colon cancer blocked the development of cancer cells by up to 75%. According to these results, eating a few servings of beans each week may increase your fiber intake and help lower the risk of developing cancer. However, the current research is limited to animal studies and studies that show association but not causation. More studies are needed to examine this in humans specifically. Number 4. Berries. Berries are high in anthocyanins, plant pigments that have antioxidant properties and may be associated with a reduced risk of cancer. In one human study, 25 people with colorectal cancer were treated with bilberry extract for 7 days, which was found to reduce the growth of cancer cells by 7%. Another small study gave freeze-dried blackberries to patients with oral cancer and showed that it decreased levels of certain markers associated with cancer progression. One animal study found that giving rats freeze-dried black raspberries reduced esophageal tumor incidence by up to 54% and decreased the number of tumors by up to 62%. Similarly, another animal study showed that giving rats a berry extract was found to inhibit several biomarkers of cancer. Based on these findings, including a serve or two of berries in your diet each day may help inhibit the development of cancer. Keep in mind that these are animals in observational studies, looking at the effects of a concentrated dose of berry extract, and more human research is needed. Number 5. Cinnamon. Cinnamon is well known for its health benefits, including its ability to reduce blood sugar and ease inflammation. In addition, some test tube and animal studies have found that cinnamon may help block the spread of cancer cells. A test tube study found that cinnamon extract was able to decrease the spread of cancer cells and induce their death. Another test tube study showed that cinnamon essential oil suppressed the growth of head and neck cancer cells and also significantly reduced tumor size. An animal study also showed that cinnamon extract induced cell death in tumor cells and also decreased how much tumors grew and spread. Including 1/2 or 1 teaspoon of cinnamon in your diet per day may be beneficial in cancer prevention and may come with other benefits as well, such as reduced blood sugar and decreased inflammation. However, more studies are needed to understand how cinnamon may affect cancer development in humans. Test tube and animal studies have found that cinnamon extract may have anti-cancer properties and may help decrease the growth and spread of tumors. More research in humans is needed. Number 6. Nuts. Research has found that eating nuts may be linked to a lower risk of certain types of cancer. For instance, a study looked at the diets of 19,386 people and found that eating a greater amount of nuts was associated with a decreased risk of dying from cancer. Another study followed 30,708 participants for up to 30 years and found that eating nuts regularly was associated with a decreased risk of colorectal, pancreatic, and endometrial cancers. Other studies have found that specific types of nuts may be linked to a lower cancer risk. For example, Brazil nuts are high in selenium, which may help protect against lung cancer in those with a low selenium status. Similarly, one animal study showed that feeding mice walnuts decreased the growth rate of breast cancer cells by 80% and reduced the number of tumors by 60%. These results suggest that adding a serving of nuts to your diet each day may reduce your risk of developing cancer in the future. Still, more studies in humans are needed to determine whether nuts are responsible for this association or whether other factors are involved. Number 7. Olive oil. Olive oil is loaded with health benefits, so it's no wonder it's one of the staples of the Mediterranean diet. Several studies have even found that a higher intake of olive oil may help protect against cancer. One massive review made up of 19 studies showed that people who consumed the greatest amount of olive oil had a lower risk of developing breast cancer and cancer of the digestive system than those with the lowest intake. Another study looked at the cancer rates in 28 countries around the world and found that areas with a higher intake of olive oil had decreased rates of colorectal cancer. Swapping out other oils in your diet for olive oil is a simple way to take advantage of its health benefits. You can drizzle it over salads and cooked vegetables, or try using it in your marinades for meat, fish, or poultry. Though these studies show that there may be an association between olive oil intake and cancer, there are likely other factors involved as well. More studies are needed to look at the direct effects of olive oil on cancer in people. Number 8. Turmeric. Turmeric is a spice well known for its health-promoting properties. Curcumin, its active ingredient, is a chemical with anti-inflammatory, antioxidant, and even anti-cancer effects. One study looked at the effects of curcumin on 44 patients with lesions in the colon that could have become cancerous. After 30 days, 4 grams of curcumin daily reduced the number of lesions present by 40%. In a test tube study, curcumin was also found to decrease the spread of colon cancer cells by targeting a specific enzyme related to cancer growth. Another test tube study showed that curcumin helped kill off head and neck cancer cells. Curcumin has also been shown to be effective in slowing the growth of lung, breast, and prostate cancer cells in other test tube studies. For the best results, aim for at least 1/2 to 3 teaspoons of ground turmeric per day. Use it as a ground spice to add flavor to foods, and pair it with black pepper to help boost its absorption.